Hello. So today I wanted to talk about something that we used when I worked on a unit where we had a lot of hospice patients. And it could be different depending on your facility. And those are Swabsticks. So if you don't know what a Swabstick is, or if you've never worked with a hospice patient before, or somebody that can't necessarily eat food or drink water sometimes, not necessarily just hospice. Sometimes these are good to use, and so this is what they can look like. So it's just a little packet like this, and you can see the stick that's in there. Basically, this is to help clean their mouth to provide oral care for somebody who, like I said, is on hospice, doesn't really get out of bed, and maybe they have a fragile mouth, or they can't open their mouth very far to get a toothbrush in there. It just really depends on the person and what's in their care plan. So I'm going to open this and show you what it looks like. So it's literally just this, and you just get it wet. Some people just use water, and like I said, this will depend on your facility, it will depend on the patient, and it will depend on the patient's care plan. But some people, you just use water to keep them hydrated, to keep their mouth from getting really dry. This is especially true in hospice, and that's why I have these other types of swab sticks to show you. I have one other type of swab stick to show you, I should say. But this can also be used for oral care. I have worked in facilities who just want you to use water. They don't want you to use mouthwash or anything like that. And then I have also worked in another facility where they want you to do full oral care with these little swab sticks using mouthwash. It looks like a little sucker, but it's just foam. You can see how easily it kind of smushes. I don't know what word to use, but you literally, I have another swab stick here to show you. You literally just, like if this was a little cup, you can just dip it in whatever your solution is, whether that's water or the mouthwash, and then you just put it in their mouth and swab the insides of their mouth, getting all the tooth surfaces by their cheeks and by their tongue. But I will say, if you have somebody who is confused, especially if they are a dementia patient, I would recommend, if they have a bite block that you can use for these little swabs, definitely utilize those, because you can easily get bit, or they can bite down on this and you can have a really hard time getting this out of their mouth. I've had it happen once, and that was with a lady who had dementia, and I'm not sure if it was Alzheimer's, but she had dementia, and she was on hospice. And so as I was going to do oral care with the swab, she bit down. She didn't bite me because I was holding the end. I wasn't like down here like it was a pencil or anything. I was holding the end of it, and I was swabbing the inside of her mouth with it, and she bit down like right about here, and she would not let it come out of her mouth. Now, whether she understood what was going on or not, I highly doubt, since she had dementia, but she like would not release the swab out of her mouth. So that's why I said, if they have a bite block available, definitely utilize that. And if you don't know what a bite block is, or you don't know how to use it, just ask your nurse if they can help you with it. Because obviously oral care needs to be done even in hospice. They still need care, and sometimes these swab sticks with hospice is the only way that they're getting any type of moisture inside their mouth. Some of them don't drink anymore. Some of them, the only fluids they're really getting is from IV, if they chose that. But a lot of them choose not to get fluids or nutrition. So just keep that in mind. And then these other swab sticks that I have to show you are lemon glycerin swab sticks. So it comes in a little package like this. And this is mostly for keeping the mouth from getting dry. And you can also use these, I should say it's not just hospice, you can also use these after somebody's had surgery or something like that, where they're kind of out of it a little bit and you need to help them. I just think it's funny, like I'm reading the warnings as I'm talking about this, and it says, do not use in the eyes. Why would you use this in your eye? It says right on there, Swabsticks. So this has glycerin, citric acid, lemon flavoring. And so I'm just going to open this and show you what these kind of look like. They are a little bit different. I mean, they're still similar, but they are a little different. So let's look at these. So this little packet has 3 of the Swabsticks in there. So these look more like giant Q-tips. I don't know how well you can see that, but it looks like a giant Q-tip. And like I said, there's 3 of them. And I have worked at a hospital where they didn't just have lemon. They had something else. I forget what flavor it was. But I worked their agency, and it wasn't just lemon flavor. They had one other flavor for people who were either allergic to lemons or just didn't like lemons, I guess. But you do oral care the same as you would with the other ones. You just take it out, swab the inside of the mouth, and this is not for like oral care as much as it is for like keeping them hydrated or keeping their mouth moisturized. This is just kind of to stop their mouth from drying out completely. And if you've ever had surgery before, you know what that feels like, waking up with a dry mouth to the point where sometimes it can be painful. It can cause you to cough. Like it's rough. But yeah, so you have, let me pull them out again so you can see side by side. So here's the one, the lemon glycerin one, and here's just the regular one. So obviously different, but they still use pretty much the same purpose, or have the same purpose, I should say. So you can see the difference there. This is for regular oral care, and this is more for like keeping the mouth from drying out. So anyways, I hope you enjoyed my little show and tell of Swabsticks, the most entertaining subject in the world. But anyway, I thought it would be interesting because you guys were asking, or I had a couple of new CNAs who were asking for tips and things like that with regards to caring for hospice patients. And so that is my tip for it. And I hope you guys enjoyed. I hope you got something out of it. Let me know if there's any other topics that you would like me to talk about in a future video, or if there's anything that I can help you with, CNA related, phlebotomy related, college related, financial related, or public and community health related. So with that being said, I will talk to you guys again in my next video.